Hello everyone, I am Dr. Sunil Vyas. I am the specialist pulmonologist here at Aster Hospital, Kisses. I'll be giving a nutshell about the diagnosis as well as the treatment of obstructive sleep apnea. So, obstructive sleep apnea is diagnosed by doing a sleep study. We call it, and some call it as polysomnography also. So, sleep study is done in 4 ways. There are 4 levels of sleep studies which can be done. The level 4 sleep study is a study which they just check the oxygen saturation overnight, which is known as nocturnal oximetry. So all the patients who have a problem in nocturnal oximetry, that means drop in oxygen saturation in the night, they go to a further study to level 3, where a level 3 study is done at home. It can be performed at home also, which is known as limited channel sleep study, where limited channels are placed, for example oxygen saturation, ECG, abdominal movements, as well as the nasal thermistor to look at how much flow is passing through the nose or the nostrils. So that's a limited channel, which is a level 3 study. Level 2 sleep studies are done is a complete polysomnography, where we look at the brain waves, which is the EEG, electroencephalogram. Then we look at electromyogram, that is the muscular movements. We look at electrooculograph, which is the eye movements during sleep, as well as the other channels which are used in level 3, the oxygen saturation, abdominal girth, ECG, the nasal thermistor, as well as that's a level 2, but it's an unattended level 2 sleep lab. This is the sleep lab which we have in our hospital. So it's a level 2 sleep lab which is done unattended. So the difference between a level 2 and a level 1 sleep lab would be that in level 1 it is under complete supervision, attended by a technician overnight to see the pattern of sleep of the patient. So once we perform a sleep study, we look at the parameters in the sleep study. So the most important parameter which we look at is apnea hypopnea. Now the reason why this apnea hypopnea index has been divided, because we need to know which patients to be treated, which patients do not require any further treatment. So coming to treatment of obstructive sleep apnea, the treatment, as mentioned, as I just said about the AHI index, if somebody has an AHI index of less than 5, he does not require any treatment. Between 5 to 15, we generally advise them about sleep hygiene, which Dr. Sandeep had spoken about, what about sleep hygiene is to be followed. And anybody above an AHI index of above 15 requires a CPAP machine. Now CPAP is known as continuous positive airway pressure machine. So as mentioned by Dr. Shafiq, there is a problem in the throat as well as the muscular tubing of the upper airway, where it gets collapsed while sleeping in patients who have obstructive sleep apnea. So the CPAP machine works as a pneumatic splint. It keeps that airway open and the muscular tube open for a longer period of time, so that the air passes freely and there is no drop in oxygen saturation, and the patient also has a comfortable sleep when he gets up in the morning, which is the most common problem. These patients feel that they have slept for 8 hours, but they still feel that their sleep has not been proper. So the CPAP machine comes in 2 forms. It is a manual machine or an automatic machine. So a manual machine, we can preset the pressure, but nowadays the most common machines which are being used are automatic machines. The advantage with automatic machines are it senses the pressure requirement, how much pressure a patient requires during the sleep to maintain the opening of the upper airways. So we should always perform a auto CPAP trial after a proper polysomnography to ascertain the pressure. So a pressure range between 5 to 14.9 centimeters of water is considered that we should give a CPAP machine. If the pressure requirement is too high, somebody is very morbidly obese, severe OSA, and the auto CPAP trial says that the pressure requirement for him is above 15 centimeters of water. In that case, a bi-level positive airway pressure, that is known as BiPAP, should be advised, because that much high sustenance of pressure may not be good for the upper airway, and the patient may feel very discomforting with that. So if a patient uses CPAP machine continuously, definitely he can lead to weight reduction and overall better sleep, which will solve all his problems, as well as prevent complications like cardiovascular complications like heart failure, as well as better control of hypertension. Thank you very much.